Hello everyone, welcome to our channel. Today we are going to talk about a very important topic. That is knee pain, especially after the age of 60. Many of you might be feeling some stiffness. You might have some aches in your knees. It is a very common concern as we get older. You might think that if your knees hurt, you should just rest them. You might think that you should stop moving. But actually the opposite is often true. Gentle and correct exercise can be one of the best ways to help your knees feel better. It can help you stay active and enjoy your life. Moving your body correctly is very important. It helps keep your joints healthy. It helps keep the muscles around your knees strong. In this video, we will explore some of the best exercises. These exercises are gentle. They are effective. They are perfect for people over 60 who want to ease their knee pain. We will show you movements that can strengthen your muscles. These muscles support your knees. We will show you movements that can improve your flexibility. We will also show you movements that can help with your balance. All of these things are important for healthy knees. So let us get started on your journey to happier, healthier knees. First, let us talk a little bit about knee pain. Why do our knees sometimes start to hurt as we get older? Our knees are amazing joints. They carry our weight. They allow us to walk, bend, and move. Inside your knee, you have cartilage. Cartilage is a smooth, slippery tissue. It acts like a cushion. It helps your bones glide past each other without rubbing. Over time, this cartilage can start to wear down. This is a normal part of getting older for many people. It is often called wear and tear arthritis or osteoarthritis. When the cartilage thins, the bones might not glide as smoothly. This can lead to pain, stiffness, and sometimes swelling. Another reason for knee pain can be weak muscles around the knee. If the muscles in your thigh and around your knee are not strong enough, your knee joint takes on more stress. These muscles act like natural shock absorbers. They help stabilize the knee. When they are weak, your knee is less supported. It is more prone to pain. Inactivity can also make knee pain worse. If you do not move your knees, the joint fluid, called synovial fluid, does not circulate as well. This fluid is like the oil in an engine. It lubricates the joint. It also brings nutrients to the cartilage. So if you do not move, your knees might feel stiffer. They might feel sorer. That is why gentle movement is so important. It helps keep everything lubricated. It helps keep everything nourished. It helps keep everything moving. Remember, we are talking about gentle movement here. We are not talking about high-impact jumping or running. We are talking about movements that respect your body. We are talking about movements that help it heal and strengthen. It is all about listening to your body. It is all about finding what feels good for you. Before we jump into the exercises, there are a few very important general principles to keep in mind. These principles will help ensure your safety. They will help ensure the effectiveness of your exercise routine. First and foremost, always talk to your doctor before starting any new exercise program, especially if you have existing knee pain or other health conditions. Your doctor can give you personalized advice. They can make sure the exercises are safe for your specific situation. It is better to be safe than sorry. Second, warm up before you start. Think of warming up like preparing your body for action. You would not start a car in very cold weather and immediately drive it at high speed. You let it warm up first. Your muscles and joints need the same. A warm-up can be something as simple as walking in place for 5 to 10 minutes. You can do some gentle leg swings. You can do some arm circles. This increases blood flow to your muscles. It makes your joints more flexible. It reduces your risk of injury. Third, listen to your body. This is perhaps the most important rule. Exercise should feel like a good stretch or gentle work. It should not cause sharp pain. If you feel sharp pain, stop immediately. Do not push through pain. Pain is your body's way of telling you something is wrong. It is okay to feel a little bit of muscle fatigue or a dull ache after exercise. But sharp, shooting, or increasing pain means you need to stop. You might need to adjust the exercise. You might need to rest. Fourth, go slow and steady. You are not in a race. The goal is to move smoothly and with control. Do not rush through your exercises. Focus on the movement itself. Focus on engaging the correct muscles. Slower movements often give you better results. They are also safer. Fifth, consistency is key. It is much better to do a few exercises every day or most days of the week. It is better than doing a lot of exercises once a week. Regular, gentle movement builds strength and flexibility over time. Think of it like watering a plant. A little bit every day keeps it healthy. A big flood once a month will not work. Sixth, wear proper footwear. Choose shoes that are comfortable. They should offer good support. They should have good cushioning. Running shoes or good walking shoes are usually a good choice. Avoid slippers or shoes that do not support your feet. Good shoes can help absorb shock. They can help distribute pressure evenly when you move. Seventh, remember to breathe. It sounds simple, but many people hold their breath during exercise. Breathing deeply and steadily helps get oxygen to your muscles. It helps you stay relaxed. Inhale slowly through your nose. Exhale slowly through your mouth. Try to match your breath to your movements. By following these principles, you will create a safe and effective foundation for your knee-strengthening journey. Now, let us talk about the types of exercises we will focus on. We will look at 4 main types of exercises. These are strengthening exercises. These are flexibility and range of motion exercises. These are balance exercises. These are low-impact aerobic activities. Strengthening exercises focus on building the muscles around your knee. These include your thigh muscles, called quadriceps and hamstrings. They also include your calf muscles. When these muscles are strong, they provide better support for your knee joint. They act like a natural brace. They take some of the pressure off the joint itself. This can reduce pain. It can improve stability. Flexibility and range of motion exercises focus on moving your knee through its full, comfortable range. This helps keep the joint fluid moving. It helps keep the ligaments and tendons around the knee supple. It can reduce stiffness. It can help you move more freely. Balance exercises are crucial, especially as we get older. Good balance helps prevent falls. Falls can lead to serious knee injuries or other problems. Many knee pain issues can also affect your balance, so improving it helps in multiple ways. Finally, low-impact aerobic activities are good for your overall health. They are good for your heart. They are good for your lungs. They also help with weight management. Losing even a small amount of weight can significantly reduce the load on your knees. These activities do not put a lot of stress on your joints. They still get your heart rate up. Now, let us get into the specific exercises. We will start with some gentle strengthening exercises. Remember to warm up first. Listen to your body. Stop if you feel any sharp pain. Our first exercise is called quad sets. This is a very gentle exercise. It is great for beginners. It is great for people with significant pain. It works the quadriceps muscles. These are the large muscles on the front of your thigh. They are crucial for supporting your knee. To do a quad set, lie down on your back. You can be on a bed or on the floor. Your legs should be straight out in front of you. You can place a small rolled-up towel or a pillow under your knee for a little bit of support if that feels more comfortable. Now, gently tighten the muscles on the top of your thigh. As you tighten them, you should feel your kneecap pull up slightly. You should feel your thigh muscles become firm. Imagine pressing the back of your knee down into the bed or floor. Hold this contraction for about 5 to 10 seconds. Then relax completely. You should feel the muscles soften. Repeat this 10 to 15 times for each leg. You can do this exercise 2 to 3 times a day. This exercise helps wake up your thigh muscles. It helps them remember how to work. It does not involve any knee movement, so it is very safe if movement causes pain. Our next strengthening exercise is called straight leg raises. This also works your quadriceps. It is a bit more challenging than quad sets, but it is still very gentle. Lie on your back again, bend one knee, keeping your foot flat on the floor or bed. Keep the other leg straight. Now tighten the thigh muscle of the straight leg, just like you did with the quad set. Keep it tight. Slowly lift that straight leg about 6 to 12 inches off the ground. Do not lift it too high. Keep your back flat on the floor. Do not arch your back. Hold it there for a few seconds, then slowly lower it back down. Do not let it flop. Control the movement on the way down. Repeat this 10 to 15 times for each leg. You can do 2 to 3 sets of 10 to 15 repetitions. This exercise helps strengthen your thigh muscles. It also helps improve the stability of your hip. If lifting the leg is too hard at first, you can just practice tightening the muscle without lifting. The third strengthening exercise is hamstring curls. Your hamstrings are the muscles on the back of your thigh. They work together with your quadriceps to support your knee. To do hamstring curls, you can either stand or lie down. Let us describe the standing version first, as it is often easier to set up. Stand up straight. Hold on to a sturdy chair or a wall for balance. Slowly bend one knee. Bring your heel up towards your bottom. Try to keep your knees side by side. Do not let your thigh swing forward. Only go as far as you can without pain. You should feel the muscles on the back of your thigh working. Hold this position for a second or two. Then slowly lower your foot back down to the floor. Repeat this 10 to 15 times for each leg. You can do 2 to 3 sets. If standing is difficult, you can lie on your stomach. Then bend your knee and bring your heel towards your bottom. This targets the same muscles. Next, we have calf raises. Your calf muscles are located on the back of your lower leg. They are important for walking. They are important for pushing off the ground. They also help with ankle and knee stability. To do calf raises, stand up straight. Hold on to a sturdy chair, a counter, or a wall for balance. Slowly raise up onto the balls of your feet. Lift your heels off the ground. You should feel the muscles in your calves tighten. Hold for a second at the top. Then, slowly lower your heels back down to the floor. Do not let them drop. Control the movement. Repeat this 10 to 15 times. You can do 2 to 3 sets. This exercise helps strengthen your calf muscles. It also helps improve the strength of your ankles. Our fifth strengthening exercise is called wall slides or mini squats. This exercise helps strengthen your thigh muscles. It does not put as much stress on your knees as a full squat. Stand with your back flat against a wall. Your feet should be about shoulder width apart. They should be about a foot away from the wall. Slowly slide down the wall. Bend your knees slightly. Only go down about 4 to 6 inches. You should feel your thigh muscles working. Do not go so low that your knees are bent at a sharp angle. Keep your back flat against the wall. Hold for a few seconds, then slowly slide back up the wall. Repeat this 8 to 12 times. Do 2 to 3 sets. This exercise is excellent for building quadriceps strength in a controlled way. It is gentle on the knees because the wall supports your back. The last strengthening exercise we will discuss is chair stands, also known as sit to stands. This is a very functional exercise. It mimics an activity you do many times a day. It strengthens your leg muscles. It helps with balance. Sit in a sturdy chair without arms if possible. Your feet should be flat on the floor. They should be about hip width apart. Lean slightly forward. Using your leg muscles, push up to a standing position. Try not to use your hands to push off the chair if you can. Stand up fully. Then slowly lower yourself back down to the chair. Control the movement on the way down. Do not just plop back into the chair. Repeat this 8 to 12 times. Do 2 to 3 sets. If this is too difficult without using your hands, you can use the chair arms for support at first. As you get stronger, try to use your hands less and less. This exercise is fantastic for building functional strength in your legs. It helps you get up and down more easily in daily life. Now let us move on to gentle flexibility and range of motion exercises. These exercises help to reduce stiffness. They help to improve how far your knee can move comfortably. Remember, smooth and controlled movements are key. Our first flexibility exercise is called heel slides. This is very gentle. It is great for restoring knee bend. Lie on your back on a bed or the floor. Your legs should be straight. Slowly slide one heel towards your bottom. Bend your knee as you slide your heel. Keep your heel on the surface. Only go as far as is comfortable. Do not push into pain. You will feel a gentle stretch in your knee and thigh. Then slowly slide your heel back to the starting position. Straighten your leg. Repeat this 10 to 15 times for each leg. You can do 2 to 3 sets. This exercise helps improve the bending motion of your knee. The second flexibility exercise is knee bends while seated. This is similar to heel slides, but you are seated. Sit in a sturdy chair. Your feet should be flat on the floor. Slide one foot back underneath the chair. As you slide it back, your knee will bend more. Only go as far as comfortable. Hold for a few seconds, then slide your foot forward. Straighten your leg out in front of you. You will feel a gentle stretch on the back of your knee. Hold for a few seconds, then bring your foot back to the starting position. Repeat this 10 to 15 times for each leg. This helps improve both the bending and straightening range of motion in your knee. Third, we have a gentle hamstring stretch. Tight hamstrings can pull on your knee. This can contribute to pain. There are a few ways to do this stretch gently. One way is to sit on the floor or a bed with one leg straight out in front of you. Bend the other knee and place your foot flat on the floor beside the straight leg. Gently lean forward from your hips. Reach towards your toes on the straight leg. Do not round your back. Keep your back straight. You should feel a stretch along the back of your straight thigh. Hold for 20 to 30 seconds. Relax. Repeat 2 to 3 times for each leg. Another simple way is to use a towel. Lie on your back. Loop a towel around the ball of one foot. Hold the ends of the towel with both hands. Gently pull the towel towards you. Keep your leg as straight as possible. You will feel the stretch in your hamstring. Hold for 20 to 30 seconds. Repeat 2 to 3 times for each leg. Next is a gentle quadriceps stretch. Tight quads can also affect your knee. This stretch helps lengthen the muscles on the front of your thigh. Stand up straight. Hold onto a sturdy chair or a wall for balance. Bend one knee. Reach back and gently grasp your ankle or foot with the hand on the same side. Gently pull your heel towards your bottom. Keep your knees close together. Do not let your knee point out to the side. You should feel a stretch along the front of your thigh. Do not arch your back. Keep your body straight. Hold for 20 to 30 seconds. Release slowly. Repeat 2 to 3 times for each leg. If you cannot reach your foot, you can use a towel or a strap around your ankle. Pull on the towel to bring your heel closer to your bottom. Now, let us move on to balance exercises. Good balance is essential for preventing falls. Falls can lead to severe knee injuries. It also helps you feel more confident and stable when you move. Our first balance exercise is standing on one leg. Always have something sturdy nearby to hold onto for support. You can use a counter, a sturdy chair, or a wall. Stand tall with your feet hip-width apart. Shift your weight onto one leg. Slowly lift the other foot a few inches off the floor. Try to hold this position for 10 to 15 seconds. Keep your standing knees slightly soft, not locked. Focus on a spot in front of you. If you feel unsteady, touch your fingers lightly to your support. Slowly lower your foot. Repeat on the other side. Try to do this 5 to 10 times for each leg. As you get better, you can try to hold for longer. You can try to use less support. The second balance exercise is a heel-to-toe walk. This exercise improves balance and coordination. It is often used to assess balance. Find a clear space. Imagine a straight line on the floor. Place the heel of one foot directly in front of the toes of the other foot, so your heel touches your toes. Walk forward slowly in this manner. Take small, deliberate steps. Keep your gaze forward. Try to take 5 to 10 steps in a straight line. Then turn around and walk back. Do this 2 to 3 times. You can place your hands on your hips to help with balance. If this is too challenging at first, you can place your feet a little further apart. You can walk with a slight gap between your heel and toe. As your balance improves, bring them closer together. Great. Let us continue. Finally, we come to low-impact aerobic activities. These activities are wonderful for your overall health. They are good for your heart. They are good for your lungs. They help manage your weight. They also keep your joints moving without putting too much stress on them. Remember, every extra pound of weight puts about 4 pounds of pressure on your knees when you walk. So managing your weight is very beneficial for your knees. Low-impact activities help you burn calories and stay active. The first and simplest low-impact aerobic activity is walking. Walking is one of the best exercises for knee pain. It is natural. It is easy to do. It helps keep the joint fluid moving. It strengthens the muscles used for daily activities. Start slowly. If you are new to exercise or have a lot of pain, start with just 5 to 10 minutes of walking. Walk at a comfortable pace. You should be able to hold a conversation while walking. Gradually increase your walking time. Aim for 20 to 30 minutes most days of the week. You can break it up into shorter walks throughout the day if that is easier. For example, 2 15-minute walks instead of 1 30-minute walk. Walk on soft, even surfaces when possible, like a park path or a track. Avoid uneven terrain that might cause you to stumble. Wear supportive shoes. Think of walking as a gentle massage for your knees. Our second low-impact option is cycling, specifically using a stationary bike. A stationary bike is excellent for knee pain because it is non-weight bearing. This means your knees are not supporting your body weight. This reduces stress on the joint. The circular motion helps lubricate the knee joint. It strengthens the muscles around it. Adjust the seat height so that your knee is only slightly bent at the bottom of the pedal stroke. Your leg should not be completely straight. It should not be bent too much. Start with a low resistance. Pedal at a comfortable pace. Aim for 15 to 30 minutes, 3 to 5 times a week. If you do not have a stationary bike, you might find one at a local community center or gym. This is a great option for building strength without impact. The third low-impact activity is swimming or water aerobics. Water provides buoyancy. This means it supports your body weight. It takes a lot of stress off your joints, including your knees. Moving in water feels much easier. It allows you to exercise with less pain. Swimming laps is a great full-body workout. If you are not a strong swimmer, water aerobics classes are fantastic. These classes involve doing exercises in a pool. The water resistance provides a gentle way to strengthen your muscles. It improves your flexibility. It also provides a good cardiovascular workout. Check with your local community pool or gym for water exercise classes. Even just walking in the shallow end of a pool can be beneficial. Now let us talk about putting it all together. How can you create a routine that works for you? The key is consistency and variety. You do not have to do all of these exercises every single day, but try to incorporate them regularly. Here is a sample routine you could try. On 3 days a week, say Monday, Wednesday, and Friday, focus on your strengthening and flexibility exercises. After your warm-up, you could do quad sets, 10 to 15 repetitions, 2 sets. Straight leg raises, 10 to 15 repetitions, 2 sets for each leg. Hamstring curls, standing or lying, 10 to 15 repetitions, 2 sets for each leg. Calf raises, 10 to 15 repetitions, 2 sets. Wall slides, 8 to 12 repetitions, 2 sets. Chair stands, 8 to 12 repetitions, 2 sets. Then move to your flexibility exercises. Heel slides, 10 to 15 repetitions, 2 sets for each leg. Knee bends, seated, 10 to 15 repetitions, 2 sets for each leg. Hamstring, stretch, hold 20 to 30 seconds, 2 repetitions for each leg. Quadriceps, stretch, hold 20 to 30 seconds, 2 repetitions for each leg. Finish with a cool down. This could be a few minutes of gentle stretching or just relaxing breaths. On the other days like Tuesday, Thursday, Saturday, and Sunday, focus on your low-impact aerobic activities and balance. You could do walking, start with 15 to 20 minutes, gradually increasing to 30 minutes or more. Or stationary biking. Start with 15 to 20 minutes, gradually increasing to 30 minutes or more. Or water exercise, 30 minutes. After your aerobic activity, incorporate your balance exercises. Standing on one leg, hold 10 to 15 seconds, 5 to 10 times for each leg. Heel to toe walk, 5 to 10 steps, 2 to 3 times. Remember, this is just a sample. You can adjust it based on how you feel. On days when your knees are feeling particularly sore, stick to very gentle exercises like quad sets and heel slides. It is better to do a little bit than nothing at all. The most important thing is consistency. Even 10 minutes of gentle movement can make a difference. Listen to your body every day. Some days you will feel stronger. Some days you might need to take it easier. That is perfectly normal. Now let us briefly talk about things to avoid. While exercise is great, some activities can be harmful to painful knees. First, avoid high-impact activities. This includes running, jumping, and aggressive sports like tennis or basketball. These activities put a lot of pounding stress on your knee joints. They can worsen pain and damage. Stick to low-impact options like walking, cycling, and swimming. Second, be cautious with deep squats or lunges. Unless a physical therapist or doctor has specifically cleared you and taught you the correct form, avoid these movements. Deep knee bends can put excessive pressure on your knee joint, especially if you have cartilage wear. The wall slides and chair stands we discussed are much safer alternatives. They still strengthen the same muscles without the deep bend. Third, avoid sudden twisting movements of your knee. This often happens in sports where you suddenly change direction. Twisting can strain ligaments in your knee. It can cause acute pain. When turning, try to turn your whole body, not just your knee. Take small, deliberate steps when changing direction. Fourth, avoid pushing through sharp pain. We have mentioned this before, but it is worth repeating. If an exercise causes sharp, shooting, or increasing pain, stop. Do not think you need to tough it out. Pain is a signal. It means you need to adjust what you are doing. You might need to rest. You might need to seek advice. Beyond exercise, there are also some lifestyle tips that can greatly benefit your knee health. First, weight management. We touched on this earlier. Maintaining a healthy weight is one of the most impactful things you can do for your knees. Even losing a small amount of weight can make a significant difference. For every pound you lose, you reduce the load on your knees by about 4 pounds. So if you lose 10 pounds, you are taking 40 pounds of pressure off your knees with every step. This greatly reduces wear and tear. It can significantly reduce pain. Combine your gentle exercise with a balanced diet to help achieve and maintain a healthy weight. Second, good nutrition. What you eat can affect your overall health. It can affect inflammation in your body. Focus on a diet rich in fruits, vegetables, lean proteins, and whole grains. Some foods are known for their anti-inflammatory properties. These can be particularly helpful for joint pain. Examples include fatty fish like salmon, mackerel, and sardines. These contain omega-3 fatty acids. You should aim for about 2 servings of fatty fish per week. That is like 2 small fillets of salmon. Or you can get it from a supplement, usually around 1,000 to 2,000 milligrams of fish oil per day. Another anti-inflammatory food is berries. Think of blueberries, strawberries, raspberries. These are packed with antioxidants. Aim for about 1 cup of mixed berries a day. Leafy green vegetables like spinach and kale are also beneficial. Aim for 2 to 3 cups per day. Turmeric and ginger are spices with known anti-inflammatory effects. You can add them to your cooking or drink them in teas. A little bit of turmeric in your cooking, like half a teaspoon, or a few slices of fresh ginger in hot water for tea. Third, stay hydrated. Drinking enough water is important for overall health. It helps keep the fluid in your joints healthy. Aim for about 8 glasses of water a day. This is roughly 2 liters. If you are very active or in a hot climate, you might need more. Fourth, ensure you get enough rest and sleep. Your body repairs itself when you rest. Adequate sleep is crucial for managing pain and inflammation. Aim for 7 to 9 hours of quality sleep each night. If your body is constantly tired, it is harder for it to heal. It is harder for it to manage pain. In conclusion, managing knee pain after 60 does not mean you have to stop moving. In fact, the opposite is true. Gentle, consistent exercise is a powerful tool. It can help reduce pain. It can improve your mobility. It can enhance your quality of life. Remember to always consult your doctor before starting any new exercise program. Start slowly. Listen to your body. Do not push through sharp pain. Focus on strengthening the muscles around your knee. Improve your flexibility. Work on your balance. Incorporate low-impact aerobic activities like walking, cycling, or water exercise. Combine this with healthy lifestyle choices. These include managing your weight, eating well, staying hydrated, and getting enough rest. Patience and persistence are key. You might not see results overnight, but with consistent effort, you will likely notice a significant improvement in your knee pain. You will notice an improvement in how you feel overall. You will gain confidence in your movements. You will be able to enjoy your daily activities more fully. Take control of your knee health. Start with these gentle steps today. Your knees will thank you. Thank you for watching. If you found this video helpful, please give it a thumbs up. Share it with anyone you think might benefit. Do not forget to subscribe to our channel for more helpful health and wellness tips. We will see you in the next video.